Hi guys, let's talk about PCOS today. PCOS, also known as Polycystic Ovarian Syndrome. What is it? It basically a syndrome which is associated with hormone imbalance. So what happens in PCOS is that every month, instead of an ovulation happening, the egg does not get released and it stays in the ovary, and a little fluid collects around that egg, making it a cyst. And because it keeps happening month after month after month, you see bunch of little cysts on the ovary. That's basically is polycystic or a multiple cyst on the ovary. It's very common, very common, to the point 1 in 10 women sometimes in their life will suffer with PCOS. Now, what are the symptoms of PCOS? If you are having irregular menstrual cycle, by that I mean if you are having 2 menstrual cycles at least 35 or more days apart, or less than 9 menstrual cycles in a year, means you're skipping a cycle here and there. Instead of having a monthly cycle, you're having it every 2 to 3 months, then that's one of the signs of PCOS. When this happens, when you actually have a menstrual cycle, the bleeding is very heavy, clotty, and it's painful. PCOS patients also have increased hair growth on the face, neck, breast, chest, or abdomen area. You know why? Because this ovarian cyst can produce a male hormone or a testosterone. So patients with a PCOS have excessive testosterone. That not only causes excessive hair, but can also cause cystic acne and some pigmented spots on the body. Excessive weight gain is another sign of PCOS. All of a sudden, if you start gaining weight or it's very difficult for you to lose weight, then that's one of the signs which can suggest that there could be a PCOS or a polycystic ovary syndrome going on. So how do you diagnose this condition? The history, which is suggestive of some of the symptoms, also associated with some blood work. Now, what is a blood work for? It's for 2 major reasons. To look for the imbalance in the hormones, especially excessive testosterone levels in the body, and another hormone called an insulin. There's excess of that too. Do you know why? Because we call this something called insulin resistance syndrome happens in patients with PCOS. Your body is producing insulin, but it's resistant to it. So to keep your blood sugar down, the body has to produce more and more of this insulin. So patients with PCOS have a higher level of insulin. What can it do? It can cause, we call a metabolic syndrome. And what metabolic syndrome is, with nothing but excessive weight gain, sometimes adult onset diabetes, high cholesterol, and can cause heart disease as well. So it's really important that PCOS should be diagnosed. So this was the second criteria of the hormonal imbalance. And the third thing is that we do ultrasound. And then ultrasound will show that there are multiple cysts on the ovary. So one of these 2 things, if it comes positive, we diagnose a person with PCOS. It's really important to get diagnosed, because a lot of time women think, oh, it's always been my cycles, they are abnormal, no big deal. Or some of the doctors say, oh, it's okay, it's a part of growing up. No, get checked and get treated, because there's treatment, right? There are medications. We can give you hormones. We can give you something as simple as a combined birth control, which will help regulate the cycle and treat PCOS. We can give you hormones to decrease the testosterone levels. And for sure, we can give a medication like metformin, which is given for metabolic syndrome to make your insulin levels down so you don't end up with a diabetes. So if it's not treated though, you could end up with trouble. What kind? Well, Because you're not ovulating, you could have infertility. Because you're having abnormal cycles, when you bleed very heavy, can get anemia. You could have this cyst pop in you and cause pain, like a chronic pelvic pain. You could get hirsutism, which is excessive hair growth because of the excessive male hormone. Also, you could have a metabolic syndrome, which is obesity, diabetes, high blood pressure, and high cholesterol. So all these medical complications can be completely avoided by getting diagnosed and treated. So if you have any of the symptoms I mentioned above, please either call me, call my office, or if you have an existing gynecologist, please call them and start the treatment. Goodbye.